A heart attack, also known as a myocardial infarction, is a life-threatening medical emergency that occurs when blood flow to the heart muscle is suddenly blocked. To understand how this happens, we need to look at the coronary arteries, the vital blood vessels that supply oxygen and nutrients to your heart muscle. Over time, fatty deposits containing cholesterol build up in the walls of these arteries, forming what we call plaques. When a plaque suddenly ruptures, it triggers the formation of a blood clot that can completely block the artery. Without oxygen-rich blood, the heart muscle tissue begins to die, causing permanent damage if not treated immediately. The most common symptom is chest pain that feels like pressure, tightness, squeezing, or aching in the center of the chest. This pain often spreads to the shoulder, arm, back, neck, jaw, or even the upper abdomen. Other symptoms include cold sweats, fatigue, nausea, shortness of breath, and lightheadedness. Women may experience atypical symptoms such as brief, sharp pain in the neck, arm, or back, rather than classic chest pain. Many people experience warning signs hours, days, or even weeks before a heart attack, particularly recurring chest pain called angina. If you suspect a heart attack, immediately call your local emergency number. Time is critical. Every minute counts. If prescribed nitroglycerin, take it as directed. Aspirin may help prevent further clotting, but only take it if recommended by medical personnel. If someone is unconscious with no pulse or breathing, begin CPR immediately. Place your hands on the center of the chest and push hard and fast. Perform 100 to 120 compressions per minute. If trained in CPR, give 30 compressions followed by 2 rescue breaths. Remember, heart attacks are medical emergencies requiring immediate professional treatment. Know the signs, act quickly, and don't hesitate to call for help. Your quick action could save a life, including your own. Stay informed, stay prepared, and prioritize heart health.